testing and also discomforts of pregnancy. In your textbook, the newer edition in chapter 10, there is a one-page synopsis of prenatal testing. Okay, that's the genetic chapter. And I believe in the new book it's 301. I have to see what it is in the older book. There's a one-page in your genetic chapter, a table that goes a synopsis of the prenatal testing that we're going to talk about here. Okay, so I don't know why they put it there. It really should be in chapter 12. Okay, so we know this we've talked about before, and again, it's in chapter 12, the scheduled visits. Okay, so we know if you're having a normal pregnancy, it's usually every 4 weeks up to the 28th week, and then it's every 2 weeks, okay, up until 36th week, and then it's every week. The reason why it's every week in the last 4 weeks is because that's when you start seeing things like high blood pressure in pregnancy or maybe preterm labor. So they really want to keep an eye on the person who, making sure that everything is going okay. Okay. The first very easy way to test for fetal well-being, it's a non-invasive way of doing it, and it's referring to fetal movement counts. Okay, usually a person starts to feel the fetus move between 16 and 20 weeks gestation, okay, and it's referred to as quickening. Okay, that's the term for fetal movement, quickening. And as time goes on, the baby becomes a little bit more forceful in kicking. You really start to feel it on a regular basis. So a lot of times, if the doctors and midwives will say, around 28 weeks till the day of delivery, start feeling the fetal movement counts. Okay, sometimes the same time every day, maybe after lunch, lay down for like an hour and count how many fetal kicks you feel at that time. And again, it's non-invasive, so it's showing fetal well-being if the fetus is kicking. Okay, so factors that will change the fetal kicking would be you do have a sleep and awake cycle, and so you just have to find the time of the day that the baby is awake. Okay. Other factors that will respond to decrease or increased movement is sound. Babies can hear in utero. Cigarette smoke can increase the baby from kicking, and different drugs can also dampen the kicking count. So techniques for fetal movement counts should be done at the same time each day. And it really depends on you. There's no one way that's better than another. Okay. Some doctors will say, if when you lay down, you should feel at least 4 kicks in an hour. Okay. Some will say throughout the day you should feel at least 10 kicks in an hour. The reason why it's non-invasive is because the person just, either lay down, move around, and say, "Well, I feel the baby moving." What is good about this is if the baby decreases in movement, it could be a sign of problems. The baby's not getting enough oxygen. Okay, so I had a woman who lost her first pregnancy, and she was doing the fetal movement counts on her second pregnancy, and she called the office and said, "The baby just keeps moving." I'm like, "That's okay. That's a good sign," because she was so nervous because she lost her first pregnancy. So the movement that the baby has is a good sign. Usually the baby's healthy when that happens. So that's one of the non-invasive ways to make sure the baby is okay. Purpose of assessing fetal movement provides information about fetal well-being. As we said before, it's about 16 to 20 weeks you'll start feeling it. Decreased fetal movement indicates possible fetal compromise, asphyxia, intrauterine growth restriction means they're not growing as well as they should. The movement count is usually started at around 28 weeks because usually the baby does have a pattern of kicking at that point. You have the woman lie down on her left side. 1 hour after her meal, there should be 4 movements in an hour. And again, depending on your doctor's office, some will say 10 movements an hour, 10 minutes movements in a day. You just have to see what the doctor's saying or the healthcare provider is saying to you. If there's less than expected movement, is that is felt by the woman, she would have to come in for follow-up just to make sure everything's okay with the fetus. Okay, it's just basically. Sometimes they will have like a graph for the woman to use. Someone will just, write something by the bedside when they feel the movements. Okay. Now, each time there's a follow-up visit, when the woman is going to see her prenatal physician or midwife or healthcare provider, this is usually what's done on each visit. Okay? Her weight, her blood pressure, and they compare it to what was at the beginning of pregnancy. Urine test, so they'll have her, they'll give her a cup that she can urinate into. The test for protein, which there's protein in the urine. Sometimes that means the woman has high blood pressure. Glucose, again, could be that she might be developing diabetes in pregnancy. Ketones and nitrates, which is other things that they may be looking for. So measure the fundal height. They'll go from symphysis pubis to the top of the fundus in centimeters, and that usually will indicate how many weeks the woman is in pregnancy. If there's a discrepancy in the fundal height and how many weeks she is, they would do a ultrasound to see if there was a problem. Okay. Quickening, they'll ask about fetal movements. They'll do a fetal heart rate. And between 24 and 28 weeks in the pregnancy, they'll do a 1-hour glucose tolerance test to rule out gestational diabetes. Okay. The result should be 140 or under 140, but we'll get into that when we talk about diabetes. If the woman is Rh negative, her antibody titer is reevaluated, and if she doesn't have any sensitivity, they'll give her Rogaine in the pregnancy, 24 to 28 week time frame. Fetal heart rate assessment is performed at each prenatal visit, usually starting around 10 to 12 weeks. That's gestation. It's done with a Doppler device. Other things we just talked about, we'll be asking her, again, we'll be assessing her as the pregnancy goes on, particularly in the last trimester. We're going to ask her questions having to do with high-risk problems that can occur to her and the baby. So we'll start looking to see if she has any of the signs and symptoms of, preeclampsia, which is when we have high blood pressure. So a weight gain of more than like 2 pounds during each week would be a sign of that. Headaches would be a sign of that. Proteinuria. We'll ask her to see if she has any kind of edema of her. Everybody has ankle edema. Most people have ankle edema. That's normal in pregnancy. But having it of the face and hands, that could mean she has this high blood pressure in pregnancy. Other things we'll be asking her about if she feels dizzy or headachy. Other things that we're going to ask her about is signs and symptoms. We'll go over signs and symptoms of preterm labor with her. Again, sometimes it's a subtle feeling of preterm labor. She might have a backache, a constant backache, or an intermittent backache. She might feel tightening of her uterus on a regular basis. She might even say that she has like diarrhea. That can also happen. Heaviness in the legs. They feel the legs a little bit more because the fetus might be descending a little bit. We'll go over other signs of pregnancy, bleeding, if she has any vaginal bleeding, or a fever in the pregnancy, that she really needs to call her healthcare provider. So all this, we start talking about it from 20 weeks on, these kind of risk kind of behaviors that can happen. And it can be subtle things, but it's always good to know what to look for and when to call the healthcare provider. Let's see what else. We said headache, edema, bleeding, signs of preterm labor, cramping, dull backache, sometimes even an increase in vaginal discharge. During this time, we'll recheck her hematocrit and hemoglobin levels. Okay? Between 37 and 40 weeks gestation, screening will occur for Group B score. Okay? How many people have seen GBS on the prenatal charts? And a lot of them will say, positive or negative. And what they'll do is usually the woman gets tested for ruby strep around 36, 37, 38 weeks gestation. So they'll do a swab of her vaginal area and see if she's positive for ruby strep. If she is, then they will give her antibiotics when she is in labor. Okay? If they don't know her status, they'll still give her antibiotics when she's in labor if she didn't get to that point of inject. They will screen her for gonorrhea and chlamydia also. Then you start to review them. Between 37 and 40 weeks, you start to review signs and symptoms of labor and when to call the healthcare provider. Now, again, I usually tell patients if their water breaks, call the healthcare provider. Why do you think that would be? What happens when the water breaks? What could happen? Okay, umbilical cord can be descending. Okay, so that's something that you really, yes, an infection also. If she has her membranes ruptured for more than 12 hours, she's at high risk for infection. There's no doubt about it. The other thing is the fear that the umbilical cord might have been, pushed out with the amniotic fluid coming out, and the baby could be at decreased oxygen. The infection, you're right about that too. Okay, so that's some of the things we usually will tell the patient when she starts to feel like that chapter on true versus false later, if she starts to feel the contractions in her back coming around like a belt, and it's consistent and it's coming closer and closer together, lasting longer, that's usually a sign to the person that she is in labor. The real true sign of labor is dilation of the cervix. Now, for fetal well-being, this is another aspect of asking people questions about the pregnancy, but also screening them for possible health issues with the baby when the baby's still in utero. So there's certain things that they will use to observe or find out information about the baby. First thing they usually will do is an ultrasound. Fetal ultrasound is usually used because they want to identify that there truly is a baby, a sac, and heart beating. Okay? They can determine the gestational age of the baby. So when the baby is maybe 6 weeks in utero, they'll do what they call a crown to rump measurement, meaning the biggest head to its bottom. And that's usually to give you an idea how far along the pregnancy is. As the pregnancy progresses, they'll start doing head circumference, femur length, abdominal circumference. That will give you an idea of the baby's gestation. The best time for ultrasound to really know the gestational age of the baby is before 20 weeks gestation. Okay? Or 20 weeks will go back from there. Because the baby all fetuses will grow at the same rate up to 20 weeks. After 20 weeks, the babies will take on whatever is genetically theirs, meaning if the parents are tall, the baby might be longer than other babies. If the parents are short, the baby might be shorter than other babies. So it's not as, the indications of ultrasound as far as gestational age after 20 weeks gestation is not as good as it would be before 20 weeks. So to get a due date and all that about the baby. Also, if you want to detect if there is any twins or triplets in the pregnancy, they can do that with an ultrasound. Any kind of anomalies in the baby, that would be also picked up in ultrasound. It's, as I said, this is non-invasive also. Really, all you have to do is put gel on the belly, tell the woman to drink a lot of fluids because you want her bladder to be full, because the bladder is underneath the uterus, so it will bring the uterus closer to her skin surface. You can see it better. Okay. Ultrasound is performed in the first trimester, and again at about 18 to 20 weeks gestation. The second one is looking for any kind of malformations, checking for growth, and verifying the due date. Okay, so again, and usually if a person has a history of maybe cardiac problems, whether genetic cardiac problem, they will sometimes do an echocardiogram at around 20 to 21 weeks gestation, just to make sure. Okay. And again, this is what you're seeing here. You can see the woman's belly has that linear nigra. You see that dark line. maximum hormones of pregnancy, and that will disappear after she has her baby. Okay. And as the pregnancy progresses, okay, after about 20 weeks, they will not ask the woman to drink, 3 8-ounce glasses of water or whatever. Because the baby is, you can see the baby closer to the skin now. So really it's like before 20 weeks is when they want you to fill yourself with water. So it brings the uterus closer to the skin surface. And you can see this woman here, she looks like she is about probably 36 weeks or so. If you're judging on her fundus, her fundal height, you can see it's way beyond the belly button. The belly button's 20 weeks, so she's beyond that as far as pregnancy goes. And again, this is a picture of the fetal face. They have such better pictures now with the 3D and all for the baby, but let's see that. Baby's eyes and nose. Other reasons for, maternal reasons for ultrasound in the pregnancy, for the mother, again, if she has a shortened cervix, okay, her cervical length is shorter than it should be, she puts her at risk for preterm labor. Okay, so they will measure her cervix if she had preterm labor in her first pregnancy, or she thinks she's having it in this pregnancy. They will measure her cervical length. Okay. Also, something called cervical incontinence or cervical insufficiency. Again, we get into this one probably later on, like next week, about this, where the cervix is dilated on its own for different reasons. They pick that up. And if there's vaginal bleeding, they will look to see if it's a placental problem, which it could be. So those are some of the other things that it's used for. Other things, fetal anomaly, fetal death, placental problems, preterm labor. So it's very handy and non-invasive, which is nice. Some of the other things that are invasive to the mom and the baby, amniocentesis. Has everybody heard of amniocentesis before? Yes? Okay. Amniocentesis is usually performed at about 16 to 18 weeks gestation. Okay. And what this is, it's screening test, not really screening, it's actual test for chromosomal abnormalities, okay, in the fetus. So usually the people who are the ones getting the testing is if they have a family history of some kind of genetic disorder. If a woman's going to be 35 years old at the time of her delivery, okay, there's a higher risk for Down syndrome in the baby. So that's a possibility that they want to get tested to the woman, okay, at the time. As I said, chromosomal disorders in the family, or the first baby, or if the woman's going to be 35, they will do the amniocentesis. Okay. Nursing responsibility, you educate the woman about the ultrasound, because when she has an amniocentesis or either that or chorionic villus sampling, they'll use an ultrasound to pinpoint where the amniotic fluid is or where the chorionic villi the sample. So they will have to do an ultrasound first. So again, amniocentesis is about 16 weeks in the pregnancy. Chorionic villus sampling is about 10 weeks in the pregnancy. So they will need to have the bladder full, okay, while they are doing the ultrasound on the woman. Some of the things with the amniocentesis is they are going to draw up fluid, amniotic fluid, about 20 mL of amniotic fluid, so they go into the needle. Okay. And it can also tell the sex of the baby. Okay. And it's a procedure where you educate the mom beforehand. They do say some doctors put lidocaine in the skin, but the doctors I work with, they never do the lidocaine. They just put the needle, like a 4-inch needle, into the woman's abdomen. And the funny stories about that is we have the father, right? The father of the pregnant woman, on her father, the baby. And he would always want to come in to see the amniocentesis and hold the mom's hand, you know. And I can't tell you how many times, the funniest story is, the woman came in with a teddy bear. So came in with a teddy bear, hugging her teddy bear from the amniocentesis. And she handed it to her husband, and he's hugging the teddy bear while she's having the procedure done. The next thing you know, you see him going down like this onto the floor, passing out with a teddy bear in hand. And so we stopped having the fathers come in to see the amniocentesis. We had a number of them going down the count. But it was the funniest thing is you see this guy squeezing that teddy bear as it's falling to the ground. But again, people will. I remember some women coming in with headphones on, listening to music. The procedure itself probably takes no longer than between the ultrasound and getting the fluid out no more than 5 minutes or so. So it's not a long procedure. And again, it does evaluate the health of the baby. This is performed between 16 to 18 weeks. They really don't like to do it earlier than that, to be honest with you. Again, they'll have an ultrasound to locate the amniotic fluid. A 5-inch 22-gauge needle is used to aspirate the fluid. And this is a picture of, this is the Newport one, let's see if I get to the other one. Well, I can talk about the Newport one too, since we're on Newport here. Newport translucency in pregnancy. This is another test that's done, and what it is a screening test for thickness behind the baby's neck. What was that?
It's on the top the bottom.
Yeah, no, I was just up there. All the way up.
On the video.
The thickness is associated with and other major chromosomal defects. More than 50 fetal abnormalities and genetic syndromes.
All right, so this is for the fetal nuclear translucency test, or we'll see it as FNT, or we'll just have it as nuclear translucency test. Again, it could be NT. So usually they'll do this testing. The testing is by ultrasound, so it's not invasive. They usually do it around 10 to 13 weeks. Some will say 11 to 13 weeks. And what they're doing is measuring the back of the baby's neck, okay, for fluid. If the baby, and again, it's non-invasive, it's just an ultrasound. Studies have shown that if the baby has a thickness of 3 millimeters or more in the back of its neck, okay, that the baby is at 95% chance that the baby could have Down syndrome, spinal bifida, and other disorders. So it's a screening test, but it does show a lot. So they measure the amount of fluid in the back of the baby's neck. They usually do this in the first trimester of pregnancy. Okay. And it gives a lot of information about the possibility of the baby having this problem. This is great.
Nuchal translucency is a black space seen by ultrasound behind the fetal neck and is produced by the collection of fluid under the skin. Nuchal translucency is observed in all fetuses between 11 and 13 weeks and 6 days of pregnancy. In fetuses with trisomy 21 and other abnormalities, the size of nuchal translucency tends to be higher than in normal fetuses. In the measurement of nuchal translucency, the ultrasound image should be big so that the fetal head and upper thorax occupy the whole screen, and the profile view of the fetal face should be visible. About 5% of euploid fetuses, the MT is above the normal range, as shown by the blue band. About 75% fetuses with Down syndrome and other chromosomal defects are dots. The MT is above the normal range, the blue band.
Upside down.
Increased fetal MT thickness is associated with trisomy 21 and other major chromosomal defects, more than 50 fetal abnormalities and genetic syndromes, and fetal death. However, in the majority of cases, the MT resolves and the babies are born healthy.
I'm scared.
But everybody understands what that's about. They measure the back of the baby's neck. And if it's 3 mm or greater, they have to do further testing on the baby to make sure that the baby's not having any kind of chromosomal disorders. Oh, escape? Good with those. That's right. Okay, thank you, thank you, thank you. Okay, these are my favorites here. Now, this is the amniocentesis I was just talking about.
Are available on the server.
Was that?
Yeah. And heat it up.
We're gonna drink again. Yeah, we have to drink soon, yo. We're at Thursday.
This is the amniocentesis.
Today?
Thursday?
I don't have classes.
Amniocentesis is
Thursday,
a
yeah,
procedure
Thursday.
that lets doctors detect or rule out problems with your baby's health
You really?
long before birth. In the uterus, your
You're
baby is
mad,
surrounded by amniotic
Yo, you
fluid
fucking whack.
that provides protection and nourishment.
What?
Floating in the
I
fluid
think. Yo, you ratchet as fuck. It's called. That's a candy cane.
from your baby, providing doctors with genetic material
They're
to test.
getting the fluid.
In amniocentesis, your doctor will take a sample of this fluid
Kiss it, kiss it.
to test for specific genetic disorders and birth defects. Amniocentesis is usually done in the second trimester of pregnancy at 15 to 18 weeks. It is generally offered to women with certain risk factors, age 35 or older, which increases the risk of chromosomal disorders such as Down syndrome, a previous child or pregnancy with a birth defect, blood test or ultrasound suggesting a birth defect, such as Down syndrome or neural tube defects, or a family history of genetic disorders, such as cystic fibrosis. Amniocentesis may also be done in the third trimester for these reasons: to determine if the baby's lungs are mature enough should early delivery become necessary, to diagnose a uterine infection, or to check for anemia in a baby with Rh incompatibility. To begin your procedure, your doctor would use ultrasound to create an image of the fetus and nearby structures on a computer screen. Looking at this image, the doctor can choose a safe place to insert the needle. Your doctor may give you an injection of local anesthesia to numb the surface of your abdomen where the amniocentesis needle is to be inserted. Carefully watching the ultrasound monitor to avoid contact with the placenta or the baby. Your doctor will introduce the thin needle through your abdominal wall into your uterus and into the amniotic sac. He or she will then withdraw a small sample of amniotic fluid, remove the needle, and cover the site with a bandage. Your body will make additional fluid to replace what was removed. Your doctor will continue to monitor the ultrasound to check that the fetal heartbeat is normal and the baby tolerated the procedure well. You may feel mild cramping or pressure in your lower abdomen. For about 24 hours after your procedure, you will be advised to avoid physical stress, such as vigorous exercise, lifting, prolonged standing, and sexual activity.
That sucks. That sucks.
See that the needle goes in, usually pull out about 20 mLs of fluid from the amniotic fluid there.
Is it quiet?
So it can also determine the sex of the baby, the amniocentesis. And the thing about, you see here it says empty bladder, because at this point, they don't want to touch anything with the bladder, or it risks accidentally going into the bladder.
Does it heal right away?
What's that?
Does it heal?
Yeah, it does, yeah. It's like, usually the woman's fine even after right after the procedure, but they just look precautionary about it. Okay, so some of the benefits of having a amniocentesis versus what we're going to talk about later is a chorionic villi sampling, villus sampling. The amniocentesis is usually performed at around 16 weeks. It can go up to 18 weeks gestation. It will evaluate the health of the baby for genetic defects, inborn errors of metabolism, like that PKU and all that stuff there. Neurotube defects, it will show, it will also have infections, genetic disorders, sex of the baby. So all of that is done with the amniocentesis. The disadvantage of this amniocentesis, the baby's 16 weeks now, and it takes a little bit longer for the results to come back. Okay, so it might take 5 days to come back, 4 or 5 days for the results to come back. The other thing with the amniocentesis is that it's done at 16 weeks, so you're already into your second trimester of pregnancy. Okay, so people know you're pregnant, and if you have results like a Down syndrome child, of course you have the option of keeping the baby because you have the option of not. So again, you're further along in the pregnancy, and to abort a pregnancy at about 18 weeks is very difficult. You have to go through labor, okay, to decide not to keep the pregnancy. Okay. The risk of miscarriage or losing the baby with an amniocentesis is like maybe less than 1%. So it's a real small amount of women who might lose the baby because they go in through the amniotic fluid, and there's a possibility that the woman could get an infection into the sac where the baby is. There's a possibility the membranes could rupture. Okay, and again, the baby, the woman could go into labor. So that's some of the disadvantages of the amniocentesis. In one big advantage compared to that chorionic villus sampling we were talking about is that the amniocentesis, we're getting amniotic fluid, and we can actually see if you test for neurotube defects, okay, in the baby, okay. Where when we do a chorionic villus sampling, we don't have fluid. We're going into just the placenta, so we can't test for neurotube defects. So that's the differences there. Okay. The amniocentesis is also able to be used in the third trimester of pregnancy, and the use of it in the third trimester of pregnancy is what it's set up on the YouTube, is that it will check for lung maturity. Okay, let's say a woman has high blood pressure in pregnancy, and the baby's not moving as much, and they think, okay, it's 36 weeks, let's get the baby out and do better. They can do an amniocentesis to check for fetal lung maturity, okay, at that point in time. And then if it looks mature, they can deliver the baby thinking that the baby's not going to have respiratory distress syndrome. Okay. Other things that they can use in the third trimester, as they said in that film, you know, to pick up infections, to pick up any kind of problem that the baby might have, like anemia because the mother is Rh negative, and the baby is Rh positive. So that is also one of the other use of using the amniocentesis. Now, the chorionic villus sampling is something else that's usually, I don't know why they always, I guess they try to do it in an alphabetical order, because I would do it the opposite. Chorionic villus sampling is done earlier in the pregnancy. The usual time for this testing is 10 weeks. Okay? So 10 weeks is the average time that can be done to 13 weeks. And again, the woman has an ultrasound, and they usually will insert the needle either transvaginally, which I've never seen, or abdominally, which is what I see with the doctors who do this all the time. So they will insert the same size needle into the placenta. Okay? So the chorionic villi is really part of the placenta. Okay? So they're going to stick the needle into that part of the placenta, take a little sliver piece of that placenta out, and look at it again, the same things that the amniocentesis does, but at an early time in the pregnancy. Okay? So the advantage of this is that it's in the first trimester. The results are usually back much quicker, like 1 to 2 days to get the results back. Okay? And you know, and you have all the things that the amniocentesis has shown. Okay, except for the amniocentesis can do the alpha-beta protein, or the thing that they're looking for a neurotube defect that the CBS can't do. Okay, so you have a earlier diagnosis. You're not into the second trimester. The results are quicker. It does not detect the neurotube defects, which the amniocentesis does. Okay. And the CBS has a slightly higher risk of miscarriage, just a slightly higher risk of miscarriage than the CBS. So those are some of the things. What you need to know for the next test is when these tests are performed in pregnancy. Okay? When are they performed? The amniocentesis being about 16 weeks for So one is in the first trimester, one is in the second trimester. The fetal nuchal translucency test is done in the first trimester, around 10 to 14 weeks.
You heard that, Ken?
Those are important.
She just said
to
something
look at.
about this.
Something called PUBS, percutaneous. Googled it. Oh no, I tried to do that on YouTube, but I put capitals, and they're showing Irish pubs. That's, you know, like the pubs. Don't speak of pubs. I'm like, no, that's not what I'm looking for. Not yet. PUBS. Okay, and what that stands for is percutaneous umbilical blood sampling. Okay, so what this is, can be done at 16 weeks or later. This is a needle that goes actually right into the umbilical vein on the umbilical cord. Okay, so it's getting the baby's blood. It's actually in the baby's blood. And it's a tough test because sometimes the baby's moving and it's very hard to pin down that, the umbilical cord to get exactly into the space that you need to get. But what this has done, it's a collection of blood from the fetus cord, similar to the amnio, but it doesn't get the fluid, okay? It goes right into the umbilical cord. It's used to determine the baby's blood type, okay? It's also used to determine if the baby has any kind of infection. Let's say mother had an infection, they get passed on to the baby, okay? It also can do genetic analysis. Again, it's a harder procedure to do. And usually you want to watch after the procedure because you're going right into the baby's umbilical cord, into the baby's vein, which has blood. So when the procedure is over, you'll still see blood, like little bubbles coming out of that area. Okay, so you're watching to make sure that the bubbles stop coming out because that's the blood. So you don't want the baby to start bleeding to death or anything like that. So you sort of watch that. The procedure's not done that often. It's really for people who, let's say a mother has some kind of infection, you want to make sure the baby didn't have it, or if there's an incompatibility with the blood types. Okay, it's not without risk. Of course, leaking of blood through the cord, it can cause lacerations, hematomal infections, premature rupture of membranes, PROM. They'll monitor the mother for 2 hours after the procedure, and they'll do a follow-up ultrasound like an hour later to see if the bleeding has stopped or if the baby or developed a hematoma. Okay, so that's some of the things. The next test we're going to talk about is really referred to as a quadruple testing or marking test that they do now. Again, this test is usually done around 16 weeks. So what is that? Second trimester. Okay, so some people will refer to it as an alpha fetoprotein test, but it actually tests a lot more than that. Okay, so what we see is the person, the baby produces alpha fetoprotein through the baby's liver. Okay, so it's a protein the baby will produce in the liver. The baby urinates, right, and then it passes the alpha fetoprotein into the amniotic fluid, and then gets into the mother's bloodstream. So the alpha fetoprotein level from the fetus can be picked up with an internal serum blood test, alpha fetoprotein. Okay, so it goes to the baby's liver, into the mother's bloodstream, and they can test for this. And it's usually done around 16 to 18 weeks gestation. And what they're looking for is, remember this is a screening test. It's not 100% accurate. It's just a screening test. So what they're looking for is if the different parameters that they're looking for in that test, definition is a fourth marker. They look for internal serum alpha fetoprotein levels. Okay. They also are looking for the estriol levels. Okay. And they are also looking for something called inhibit A and HCG levels, okay, which is that hormone pregnancy that they look for. So if the levels come back low, any of these levels come back low, it could indicate the baby might have Down syndrome. Okay, so low levels of this quadruple test, or alpha-fetoprotein test, sometimes they call it. If the levels are low, it could be the baby has Down syndrome or some other genetic disorder. If the levels become elevated, okay, if it's a little bit higher than they should be, it could mean that the baby has an opening in the body, okay, meaning it could be an opening in the stomach, an opening in the head, have spinal bifida, or anencephalic, where the baby doesn't really have much of a brain. So if it's elevated, what happens is there's an opening. So in other words, that the liver that's producing this alpha-fetoprotein product will spill more out to the mother's bloodstream because there's an opening in the baby's body to allow that to occur. So the level that's higher, meaning that the baby has some kind of opening in the body. Okay, that's not abnormal. But the other thing about elevated level, it could mean that she's further along in pregnancy than she thinks she is, or she could be having twins or triplets, because now you're dealing with several different livers, and it could produce higher levels because of that. So if this screening test comes back elevated, they will go and do an ultrasound for dates, making sure her gestational age is correct, and they'll look to see if there's 1 or 2 or 3 babies in there. The lower level, she might be earlier in the pregnancy than they anticipated, but it also could mean the baby has Down syndrome or there's a fetal demise. Okay, so again, they will have to do an ultrasound to get the dates and see what's going on with the fetus. Okay. So it is a screening test. They follow up with an ultrasound, and then they could possibly follow up with an amniocentesis, depending on when this is done. The Doppler flow study. Okay. Let me give you a break now. Before, don't go anywhere yet, because I want to get attendance. Here's my Suzanne. Here's those papers. There's extra paper I can borrow. Just to have attendance done now. They have paper? I'm send it around so I can. Okay.
You're going on a break?
I guess 1 is fine.
You're going on a break?
Yeah, just put down your names.
I'm gonna smack you in the face.
And let's do a count.
Smack you.
You're 1. Let's go.
Not done.
4, 5, 6,
8, 9,
10,
12,
13.
14,
15, 16,
17.
18, 19.
okay.
24, 25, 26, 28, 29,
Do it Friday, Roseanne. Do Friday, Roseanne. Just counting.
32. 33. So we're missing 6.
I know where 2 of them.
Sign your name, and then we'll take a